What are the top 5 most severe risks associated with cataract surgery? I'm talking about potentially catastrophic complications, and most importantly, what can you do to prevent or minimize those risks? Hi, I'm Dr. Cohen, a board-certified cataract and premium lens surgeon. Over the past 25 years, I've performed tens of thousands of cataract surgeries. My goal here is not to make you anxious, but to warn you about potential risks and what practical steps you can take to minimize them, and if it does happen, how to recognize it early and prevent any serious damage to your eyes. Let's start with the simple truth. Cataract surgery is one of the safest operations in medicine, with success rates above 99% when performed under standard conditions. But like any delicate procedure, inside the eye, complications can occur. What separates a smooth recovery from a difficult one often comes down to how those complications are prevented or handled when they arise. So let's go through the top 5 biggest risks, starting with the scariest. Risk number 1 is endophthalmitis. This is the rarest but most serious risk of all, a deep eye infection that happens after surgery. It typically appears within 2 to 4 days, and in some cases even a few weeks after the surgery. The overall rate is extremely low, roughly about 1 in 2,000 cases. Yet, because it can threaten your vision, every step of modern cataract surgery is designed to prevent it. This includes your drops regimen. Most surgeons tell the patients to start taking the drops 3 days before the surgery. This way, the levels of antibiotics within the eye is high enough to prevent a potential infection. So follow your antibiotics drops instruction before and after the surgery closely. This alone can significantly lower the chances of an infection. Also, it is well known that the source of most infections is bacteria from your own lids. So ask your doctor about the condition of your lids. More specifically, you want to know if there is any bacterial overgrowth on your lids, a condition called blepharitis or rosacea. For patients with significant rosacea, I typically prescribe a topical drop for a few weeks prior to the surgery. This simple measure effectively reduces the bacterial load on the eyelids and significantly lowers the chance of infection. Now, what if an infection does happen? What can you do? You can make a huge difference in the outcome just by being aware of these specific signs I'm about to discuss. If after surgery all is well and after a day or two you suddenly notice an increase in redness, pain, eye tenderness, or clouding of your vision, it is essential to seek help immediately. And by that, I mean minutes or hours after you notice something, not days. If an infection is diagnosed and treated in a timely manner, the final outcome is usually excellent. But if the treatment is delayed, the outcome could be catastrophic. Your awareness of this issue and your prompt action can make the difference between excellent vision or a very poor outcome. The treatment is either injection of antibiotics into the eye or, in more severe cases, an emergency surgical procedure called vitrectomy. Cataract surgery risk number 2, retinal detachment. The retina is the thin layer in the back of your eye that senses light like the film inside the camera. In a retinal detachment, that layer peels away from its support tissue. So how can you prevent it? If you are highly nearsighted, ask your doctor to perform a comprehensive retinal exam prior to surgery, or even better, see a retina specialist before having the cataract surgery. If they see any holes or small breaks in the retina, they can perform a very easy in-office laser to seal them up, so they never expand into a full tear into the retina. Okay, what if it does happen to you? What are the signs? Again, like before, if this condition is recognized and treated early, it can make all the difference between excellent and poor outcomes. These signs can pop up days, weeks, or even years after cataract surgery. And you know what? They can even happen to people who never had cataract surgery at all. So here are a few things to watch for. Number one, a sudden increase in floaters. These are those little dark specks, tiny particles, or even cobweb-like shapes that seem to just drift through your vision. Number two, sudden flashes of light, also known as photopsia. Think of these as brief lightning streaks or bursts of light, usually off to the side of your vision. Number three, a dark shadow or curtain. You might notice a gray or dark shadow starting in your side vision, and it can gradually spread towards the center. Number four, blurred or distorted vision. All of a sudden, your vision may get hazy, blurry, or even a bit wavy. Number five, a sudden reduction in side vision. This is when you notice you're losing some of your peripheral vision. If you notice any of these symptoms, you should seek help immediately. And again, I'm talking hours rather than days. Time is of extreme essence here. If this happens to you, it's generally more important to do something immediately by a retina specialist rather than starting to shop for the best provider. Prompt surgery can reattach the retina in over 90% of cases. Cataract surgery slightly increases the lifetime risk of retinal detachment, particularly in nearsighted eyes where the retina is already stretched thin. Most studies estimate the overall risk to be around 3 to 5 out of 1,000 in the first few years after surgery. Interestingly enough, it can happen to you even if you never had cataract surgery, so it's good for anyone to be aware of these symptoms. The next risk of cataract surgery is macular edema. The macula is the central part of the retina responsible for sharp vision. After surgery, a small percentage of patients develop macular edema, meaning temporary swelling of that area. Vision may look slightly blurred or smudged for several weeks. The swelling results from microscopic inflammation and fluid leakage. It's more likely in people with diabetes, vein occlusion, or a previous eye surgery. The most common symptom is blurry or dim central vision. Your vision may just seem off, hazy, or less sharp than you expected after surgery, especially when trying to read or see fine details. You might also notice distorted or wavy vision. This is where straight lines, such as a door frame or a line of text, may appear bent, wavy, or curved. This can also cause difficulty reading, making it hard to focus on words. Other possible symptoms include faded or washed out colors, a slight pink tinted vision, a small dim or blank spot in the center of your vision, or new light sensitivity. If you are experiencing any of these symptoms after your cataract surgery, you should contact your ophthalmologist for an evaluation. In most cases, the edema resolves completely with a few weeks of anti-inflammatory treatment. Only a small fraction require injections into the eye. To prevent macular edema, you need to follow your post-op drops that your doctor prescribed very closely. These usually include a steroid and a non-steroidal anti-inflammatory drop. The second drop, the non-steroidal drop, is critical. There are a number of available choices. In my experience, the most effective one is a drop called Bromfenac, and I have no financial interest or relationship with any of these companies. In fact, I didn't find any difference between the brand or the generic types as long as it is Bromfenac and not something else. Anytime we used a different type of non-steroidal drop, the rates of macular edema increased. The biggest problem is that many pharmacies substitute this drop for another without even checking with the doctor first. They do it because of profit margins or insurance coverage. Anytime this happened, I saw the macular edema rates climb up. So here again, you can have a big impact on the outcome just by being aware of this issue and making sure that you get the right medication. Risk number 4 is persistent corneal edema. Now we move to the clear front window of your eye, the cornea. During cataract surgery, ultrasound energy is used to break up the cloudy lens. That energy can temporarily stress the inner cornea cells responsible for pumping out fluid and keeping the cornea clear. When those cells are damaged, the cornea can swell. Vision may appear cloudy for days or, in rare cases, weeks. This is called corneal edema. Most cases are transient and clear up quickly, but if the cell layer is already weak, as in a condition called Fuchs dystrophy, the swelling may persist. This can also happen if the lens is very dense and the surgeon uses high degree of ultrasound energy to remove the lens. This energy could be traumatic to the cornea, sometimes irreversibly so. Knowing about this ahead of time could make a big difference. If a surgeon knows this ahead of time, he or she can adjust their technique to reduce the chances of issues. If you know about this ahead of time, you can ask informed questions and ensure proper preoperative planning with your surgeon. By the way, the types of lenses that could be used in patients with Fuchs dystrophy are more limited. So if you're thinking about premium lenses, make sure to discuss your choices thoroughly with your surgeon. Remedies include hypertonic saline drops to draw out fluid, anti-inflammatory treatment, and patience. Most cases resolve over time. In rare situations, a partial corneal transplant can restore clarity. The very last risk I'll discuss is the most common risk, and it is one that happens during the surgical process. But luckily, if managed properly by the surgeon at the time of surgery, it could lead to excellent outcomes. It is called capsular rupture or tear. Inside your eye, your natural lens sits within a clear membrane called the capsule. Think of it as a thin, transparent bag holding the lens in place. During cataract surgery, the cloudy lens is carefully removed while keeping the capsule intact because it supports the new artificial lens implant. A capsular rupture happens when that thin membrane tears during surgery. If the tear extends, some of the soft lens material can slip backward into the eye, or the artificial lens may not sit securely in position. In rare cases, it can lead to inflammation or the need for a second procedure to clean up remaining fragments. The good news, in experienced hands, this condition is uncommon, well under 1% in most large studies. For example, data from the European Registry of Quality Outcomes for Cataract and Refractive Surgery, covering over 1.6 million operations, found that posterior capsular rupture rates were 5 times lower among surgeons who performed over 1,000 cases per year compared with low-volume surgeons. If a rupture does occur, remedies include placing an implant in a different position, just in front of the capsule, or in rare cases, performing a short second procedure called vitrectomy to remove any escaped material. Most patients still recover excellent vision once the eye heals. But not surprisingly, here too, surgeon experience in handling the complication can make or break the outcome. So what can you do to prevent this from happening? The only thing that you can do is to select an experienced surgeon. Their expertise not only reduces the risk of such events, but also enables them to manage unexpected situations effectively, often leading to outcomes similar to routine cases. So you might be thinking, these risks sound serious. Should I wait? That's a fair question. The short answer is this: delaying isn't safer once your vision is limiting daily life. Mature cataracts make surgery technically harder and can increase the very risks we just discussed. If glare, driving difficulty, or poor night vision are interfering with safety or independence, it's usually better to act than to wait. Now, let's connect the dots. When we look across all 5 risks, endophthalmitis, retinal detachment, macular edema, corneal edema, and capsular rupture, there are 2 critical factors. First is how educated you are about these risks and the steps you take personally to avoid them by recognizing the relevant problems and seeking timely care. The second factor is the experience of your surgeon. The only effect you can have on that is by doing your research and choosing wisely. A 2022 review in the Journal of Cataract and Refractive Surgery analyzing more than 3 million cases found that complication rates dropped by up to 80% once a surgeon surpassed the first 1,000 procedures. The difference wasn't just technical. It included better preoperative judgment, smoother patient selection, and faster recovery times. But how do you find a good surgeon? There is a link to a video on that in the description below. My promise to you, I'll keep tracking the data and share updates as new studies emerge on complication prevention and visual recovery. When new surgical tools or infection control techniques prove they make real-world results even safer, I'll discuss them here so you can make fully informed decisions. If you find this video helpful and want to understand how different lens implant options affect your visual outcomes and risk profile, watch this next video.